I'm Kelly Warner. Learning you have cancer is life-changing. There is suddenly so much information coming at you that some patients have described it as trying to drink from a fire hose. How do you take it all in? Whether you're visiting a doctor for the first time or seeking a second opinion, asking the right questions can help you understand important information about your diagnosis. When Willamette Valley Cancer Institute medical oncologist Dr. Keith Wells meets with a newly diagnosed patient for the first time, he encourages them to bring a friend or family member to the appointment.
It's so important to have someone who can write things down. That way you can go back and review it. Different people hear different things, and so having more than one set of ears can be helpful. That way the patient can be solely focused on listening to their oncologist and having that interaction.
Start by asking these questions. Exactly what type of cancer do I have? Where is the cancer located? Has the cancer spread beyond where it started?
That can help determine what types of treatments are available, whether it's surgery or radiation therapy, or if we need to do any type of chemotherapy or other systemic therapies, such as oral drugs or immunotherapies.
It's important for patients to be informed about their diagnosis, so jot down any questions or concerns you have before your appointment so you don't forget them. And never be afraid to stop your doctor and say, "I didn't understand that." It's common for patients to seek information on the internet, but Dr. Wells says user beware and always consider the source of the information.
So there are wonderful resources, but there's also the downside and the flip side to that, where there are some resources that really don't have great information or even some false information. And there's a lot of websites that have discussion boards and places where patients can interact with other patients. And some of those are scary places because you see the whole wide range of experiences.
Ask your oncologist to recommend reputable sites and help you sort through credible information specific to your diagnosis. There are additional questions that patients should ask their oncologist, not only about their specific type of cancer and treatment, but also about managing side effects and accessing support services if needed. You'll find a link to those questions at OregonCancer.com/questions. I'm Kelly Warner.